Hi, I'm Dr. Nina, board certified diagnostic radiologist, breast cancer doctor. I help busy professionals learn how they can start and how they can maintain a healthy lifestyle. The topic I want to talk about tonight is important because it comes up a lot this time of year. A lot of people are getting sick. So I want to talk about the 6 things that you should know about antibiotics. So number 1, let's just start with the basics. What are antibiotics? Antibiotics are medicines that people take to fight infections that are caused by bacteria. They work by killing the bacteria in the body. These medicines come in many different forms. It could include pills, it could include ointments, it could include liquids that are given by injections. Antibiotics can do a lot of good. For people who have serious bacterial infections, antibiotics can be life-threatening. However, if they're overused or if people take them when they're not needed, they can cause a problem, and that's called antibiotic resistance. Antibiotic resistance happens when bacteria that has been exposed to antibiotics change, so that the antibiotic can no longer kill them. In those bacteria, the antibiotic has no effect. Because of this problem, antibiotic resistance, doctors are having a harder and harder time treating these infections. So let's learn when antibiotics can be useful. So antibiotics can be useful to fight infections that are caused by bacteria. They do not work in infections that are caused by viruses. Some common bacterial infections that people get that antibiotics could be used to treat could be strep throat, pneumonia, which is infection of the lungs, also bladder infections. You should take antibiotics only when they're prescribed by your doctor. You should never take antibiotics that were prescribed to someone else. You also wouldn't want to take antibiotics that were prescribed for a prior illness. When prescribing the antibiotics, the doctor chooses carefully which antibiotic is right to treat your particular infection. Not all antibiotics work for all bacteria. When you do have an infection caused by a bacteria, sometimes the doctor may want to find out exactly what that bacteria is, so they can find the exact antibiotic to treat your infection to kill the bacteria. They do this by taking a culture. This is where they grow the bacteria in a lab. But it's not possible to do so if you've already started taking antibiotics on your own. So now that we have learned when antibiotics are useful, let's learn point 3, when antibiotics are not helpful. So antibiotics are not helpful in treating infections that are caused by viruses. So antibiotics are not helpful in treating the common cold. The common cold is caused by a virus. Antibiotics also aren't helpful in treating the flu. The flu is also caused by a virus. Now, people who have the flu can take other medications, which are called antiviral medications. But these are separate. These are different than antibiotics. Also, antibiotics are not helpful in treating most sinus infections. Most sinus infections are caused by viruses. Now, sinus infections can start out as a viral infection and then they can turn into a bacterial infection, but this takes time. So you wouldn't want to take antibiotics for a sinus infection unless you've been sick for greater than 10 days or unless you have other symptoms such as a very high fever. Antibiotics are also not helpful in treating most cases of acute bronchitis. Bronchitis is an infection of the airways in the lungs. Again, this is because most often bronchitis is caused by virus. Now, even though antibiotics don't work on viral infections, some people believe they do. And that's because they have taken an antibiotic for a viral infection previously, and then they got better. But the problem is that they would have gotten better regardless of whether they would have taken the antibiotic or not. So this is important because when we take antibiotics unnecessarily, it can cause problems. And that brings us to point 4. What's the harm of taking an antibiotic even when it may not be helpful? There are several reasons. One is that antibiotics can cause side effects. That includes nausea, it includes vomiting, it can also include diarrhea. It can also cause infections, different types of infections, such as in women, yeast infections. Also, allergies to antibiotics are common. Now, some of these allergies may be very mild. It may just be a mild rash, or it could just be itching. But some of these allergies could be life-threatening. They can develop in people who have taken an antibiotic before and didn't have any previous problems. And one of the major problems is what we've already talked about, is that overuse of antibiotics can lead to antibiotic resistance. Using antibiotics when they're not needed, they can cause the bacteria to change. This change can cause that the antibiotic will no longer hurt the bacteria. There are people who have been infected with bacteria who are that are resistant to antibiotics, often require being hospitalized, being treated with multiple medications. And sometimes they can even die because the doctors are unable to find the right medications to treat the infections. So what can we do to reduce antibiotic therapy? Reduce antibiotic resistance? There are several things. You never want to pressure your doctor to give you antibiotics when they don't think it's necessary. If you're prescribed an antibiotic, you want to take all your medicine just as it was instructed. You never want to skip doses. You don't want to stop taking your medicine without telling your doctor. You don't want to give antibiotics to someone else other than whom it was prescribed. So what happens when you have an allergic reaction to an antibiotic? Some of these can be mild, some of these can be serious. Now, sometimes some people may think that they have had an allergic reaction to an antibiotic, and it could simply be just a side effect of the medicine, such as you take your medicine, you take your antibiotic, and you feel nauseous. That doesn't mean that you've had an allergy. Nausea can be a common side effect. In women, you take your antibiotic and you get a yeast infection. That doesn't mean that you've had an allergy to the antibiotic. Yeast infections are a common side effect of antibiotics. The allergic reactions to antibiotics can go from very mild, where you just may have just a mild rash, a little bit of itching. You can have a little bit more of a serious reaction where you have hives. Hives are raised red patches on the skin, which are very itchy. There are serious life-threatening reactions to antibiotics. These could include swelling of your lip and your tongue, difficulty breathing, trouble swallowing. As I said, these reactions are serious, they're life-threatening, they require immediate medical attention. You definitely want to let your doctor know if you've had any problems or any prior allergic reactions to medications. So again, I'm Dr. Nina Watson. I'm a board-certified diagnostic radiologist, breast cancer doctor. I help busy professionals learn how they can start and they can maintain a healthy lifestyle. Here tonight talking about the 6 things that you should know about antibiotics. You can follow me on Facebook at www.facebook.com/Dr. Nina Watson. That's DrNinawatson. Good night.